This is Dr. Memdani. Welcome to Pursuit of Medicine, and we are continuing with our series of MCQ of the day. So let's dive into the MCQ. A 3-month-old infant is brought to the pediatrician for a well child visit, and his parents say that there is no concern except that they cannot palpate the right testis into the scrotum, and they cannot palpate the right testis into the scrotum. Left testis is normal, and no complications. Right hemiscrotum is empty, and a pea-sized mask is palpated in the right inguinal canal, and but it cannot be brought into the scrotum. The cremastic reflex is absent on the right side. What is the appropriate next step which you will do? Now, first thing over here, I want to tell that see, as medical students, you need to know that if this is the testis, and it is in this sac called as the scrotal sac. Okay, this is the scrotal sac and this is the testis. Now testis is in the scrotal sac, and testis is not naturally in the scrotal sac. It means that in intrauterine life, testis they develop in the abdominal cavity, somewhere near the kidneys, and then they slowly come down. And sometimes what happens is they get stuck somewhere in the path, either in the abdominal cavity or in the inguinal canal. Like in this patient, it has got stuck in the inguinal canal, so they are not palpated in the scrotum. So such condition is called as cryptorchidism. And so we'll come to what the examiner is now asking. What is he asking? He is asking for the management. So first this thing, option reassure and schedule a follow-up at 6 months seems the right option, but we'll go through the other as order ultrasound to confirm the location. See, you have confirmed the location via your examination, so you do not need to do any imaging. See, that's another thing. In cryptorchidism, you do not need, generally do not need imaging in 95% cases. You can palpate, you have palpated in the inguinal canal, good, no need to again do ultrasound. And for orchidopexy is too early. What you should do is you should reassure the parents and set up a follow-up for 6 months. What happens is in cryptorchidism we do not mess with the patient, or we wait and give him time for 6 months. In 6 months we wait for the testes to naturally descend down. If they don't descend down, we can do orchidopexy in the age of 6 to 18 months. When is the right time to do orchidopexy? It's in from 6 to 18 months. Why is this time? Because if you delay more is the chances of the patient becoming infertile. And you give HCG injections, no matter how much hormones you give, the testis is not going to come down. And perform a karyotype, no, you do not, generally you do not need to do karyotype analysis, especially if it is isolated abnormality. If it is abnormality along with there is hypospadias also, then you can go for some syndromes, but here you do not need any karyotype or anything like that. So the correct option is reassurance. So what do we need to learn from this MCQ? What we need to learn from this MCQ is that in cryptorchidism, first thing is that you wait and watch for 6 months. After 6 months, you do surgical repair. You don't do surgery. You don't prolong the surgical repair. Means unnecessary, no delaying of surgical repair. Otherwise, the patient is going to lose its fertility power. More time the testis stays in the inguinal canal or in the abdominal cavity, more going to be the destruction. Third thing is that which is not there in the MCQ is that there is also increased risk of testicular cancer in such patient even after surgery. So even after you do the surgery and bring the testis back into the scrotum, this patient will still have increased risk of testicular cancer compared to normal population. This is what you need to know for cryptorchidism. So today we have done one topic, one small topic to one MCQ. This is the goal of the series: one MCQ, one day, one small topic. So we are on our way to building good fundamental and undergraduate level concepts. And support my channel, keep watching this series. Somewhere over here I will link the past episodes of this series, so you can watch all the episodes of this series also. And do subscribe to my channel, and like, share, comment. All right, bye bye, happy studying and stay focused.